Hello, my name is Kirit Mistry. I'm the co-chair of National BME Transplant Alliance, who is actually supporting this initiative to look at the living kidney donation awareness within the Hindu community. I also chair the South Asian Health Action Charity, so we're working with this project with the other partners of University Hospital Leicester, Warwick University and the Leeds Teaching Hospital Trust. And together this is a partnership project with local communities, people who have been recipient and donors from the Hindu community to try and raise more awareness due to the shortages of organs particularly, and also living kidney donations coming forward from those communities.
When doctors told us that his first kidney was failing, it was a shock to us, and it took us back to the dialysis days. And even when we think about those days, you get, what do you call it when you...
Goosebumps.
Goosebumps, yeah. And you think, oh my God, what were you going to do? He dialyzed for 6 years before he had a transplant. When he was having his dialysis, the girls were 6 year and 1 year old. It was difficult even to take them out in a park, or take them to in the garden and play with them, or complete the parental duties. And luckily he had a cadaver kidney, which changed our life. And that lasted very nicely for 24 years. We were able to complete all the duties we had to do in life. Comparing the dialysis and the transplant life, when we got the news that the kidney was failing again, I decided that I would like to donate one of my kidney.
If you or your loved one are looking for a kidney transplant, there are two broad options. One is to wait on a national waiting list for a deceased donor kidney transplant, or you have somebody who's willing to donate a kidney and have a living donor kidney transplantation. If you have somebody who's willing to donate a kidney to you, there are a number of advantages. The most important one is obviously you could plan around your life, and you could do in a more formal ways rather than as an emergency. But also in long term, there is distinct advantage both of your life expectancy, and the kidney lasts longer if you had kidney from a living donor compared to a deceased donor.
Our primary responsibility when a live donor comes forward for a live donation is their ultimate health and their well-being. With that in mind, all live donors have to undergo stringent tests to determine their suitability for live donation. It's not a single clinician's decision whether to accept a live donor or not. It's a multidisciplinary team meeting. There's more than one physician involved. It's only when we are satisfied that their risk to their life or to their other remaining kidney in the longer term is no different to their peers, but then we go forward with live donation.
Well, here in Leicester we have a large number of the Hindu community that are on dialysis due to diabetes and high blood pressure, which both result in renal failure. So wanting donors from the community, from the Hindu community, would mean that our patients get transplanted quicker. We can do transplants before they go on dialysis, and they don't have to wait such a long time on the list if we have donors, but also we can get better matches when we have the community offering kidneys.
The day before the surgery, they did a lot of the tests again, just to make sure that in future I do not go through any problems. That this was the best health check I've ever had.
At Leicester, the live donor program is robust. The process is time consuming, but the aim is to do no harm to the potential donor. We aim to get this absolutely right, and as shown here, a number of tests and investigations have to take place. Only after these being completed is the donor reviewed by the nephrologist, that is the kidney doctor, and the surgical doctor. Once further investigations have been complete, the patient is then discussed in the multidisciplinary team meeting, which is our MDT meeting, and a double sign-off takes place. After this, both the donor and recipient then undergo an HTA, which is our independent assessment. This is the legal interview. Once this is complete, only then the donation process can take place.
It's always nice to speak to people who've been through the process because they could really give you the pros and cons. As much as medically you can explain to someone what it's going to be like, unless you've actually spoken to someone who's gone through the process, it's very difficult to know.
There are potential risks with any surgery. There's a risk of bleeding, risk of infection, damage to surrounding structures. But with our advances in surgery and our keyhole surgery, the risk of this happening is under 1%. Converting to open surgery is also under 1%. Risk of dying from the operation is very small. It's 1 in 3,000.
Lalit was very, very reluctant. It took me a few weeks to convince him that this is the best way forward. I was very determined, and he said to me, what if something goes wrong?
After having talked to the health professionals at the hospital, I think that did put my mind to rest.
One thing I would say is, I guess post-transplant I was quite tired. That was something that it was exhausting. I did feel like I lacked a lot of energy post-transplant, but actually from the 6 weeks I was ready to go back to work, and since I've gone back to work after the 6 weeks, I thankfully have never had any problems whatsoever, and I've been really looking out. And if anything, I can't notice at all that I've had a kidney taken out. Even the scars, because it was all laparoscopically, I've barely even got any scars left now, so you can barely see them. We're quite a close family, but when it came to giving a kidney, I guess, from our point of view, like, there was never any reservations about me giving my sister a kidney or her accepting it, because it was just almost a given. She's my sister, if I've got a kidney, you can have it, sort of thing. We did notice that when we spoke to other patients of our same race, that in our cultural society there seems to be, for some reason, an apprehension about donating, and I'm not sure why that apprehension exists. I'm not sure if it's medical or I'm not sure if it's cultural, but it's definitely not religious. There's no religious reason why Hindus shouldn't be able to give a kidney.
Following living kidney donation, most kidney donors live perfectly healthy life with a very good quality of life. What we do recommend is, following kidney donation, you have annual follow-up, a health check. This is mainly looking at your blood pressure, a urine test, and a blood test to check on your kidneys. About 10% of kidney donors require a blood pressure tablets in 10 years following kidney donation. There is a relative risk of kidney failure. However, the absolute risk of kidney failure following kidney donation is very little. For example, recent data from UK suggested one kidney donor needing a kidney transplant in the last 15 years. So this is very safe. You will obviously need to have a very healthy lifestyle following kidney donation, something that the team will be looking after.
We'd also like to say that there is a quality of life benefit, not just to the intended recipient, but even to the donor perhaps, because they do achieve ultimate satisfaction in seeing their own loved ones being able to live and lead a normal, healthy life. So some donors do derive a psychological benefit from going forward with live donation. I keep telling my patients that if they are born with 2 kidneys, it's not possible that we take one kidney away and that the body is just completely normal without any changes. The body does have to undergo some changes, and the other remaining kidney, in fact, does 75% of the work instead of 50% work. They may also develop gout, which is a more recent finding, and gout is again easily treatable, as you probably know. Finally, I also like to talk about pregnancy. Research from Canada, Norway and the US has shown that live donors can proceed to have entirely normal families. They can have normal pregnancies. There's no difference in the birth weight of the baby or the gestational age. They can have completely normal pregnancies. However, there is a small risk, probably 3 to 5% risk of developing preeclampsia, or in one study showed gestational hypertension. But obstetric teams can pick this up and treat them early on if necessary.
My name is Lalit Bhaidave. I am a Hindu chaplain in UHL. In difficult time, the staff, patient and family member needed my support. Then I give a religious support, a spiritual support to them. In Hinduism, there is no objection regarding the Hindu organ donation.
The Hindu religion is telling Purnamadaha Purnamidam Purnat Purnamudachyate Purnasya Purnamadaya Purnameva Vasishyate. This world is fulfill of happiness, strength, and everything is going round and round. If we are alive in this world, and sometimes some need our extra organ, like a kidney, is useful for somebody's life, it is very good. So, as a religion, it is our humble duty to give the organ donor to somebody else.
Avril donated me a kidney in the year 2008. The operation took place at the Leicester General Hospital, in our local hospitals here. It was a very successful operation, and I was given a new lease of life as a result of what Avril's done. Having known quite a lot about kidneys, first of all, I never thought that we were going to be a match. So I just took it as a kind of a joke in the beginning. When tests went on, and a few months later, I was told that yes, there is a possibility, and Avril's kidney can match yours.
People who get kidney failure do not do very well. It is worse than a cancer outcome. So, effort must be put into making people getting transplants. Now, deceased transplants is a way forward, but the problem with deceased transplants is the lack of suitable organs available for transplantation. Many people end up with developing problems while they're waiting for kidney transplants, and hence nowadays we advocate kidney transplantation right from the beginning. And the way forward is getting your kidney from one of your loved ones or family member, friends. This because live donor kidney transplants give you the best outcomes.
We have such a big family support, and most Asian families have that same support. So without even not just my dad and brother, but even our extended family and friends who were amazing, who were there all the time in and out supporting us, it was something that was really helpful actually. And actually, if anything, it's a really nice environment to be able to do it in.
The transplant has made a big difference to my life. There's no doubt about that. Because there's no more restriction on the diet, you're free from dialysis, you have plenty of time, and you have plenty of energy as well.
And as time goes on, it doesn't even cross your mind that you are going on one kidney because you don't feel any different. You're just the same person, sometimes even better because you're taking care of yourself and you got control of your life more than before.
Even now, long term, I don't feel any different to what I did, and so it's not really impacted on my life. But the difference I see to what it's made to my sister's life, I would do it all over again.
Our father used to tell us that if you get opportunity to do anything for anybody in this life, do not miss that opportunity. And here I am. I have to do it for my dear and dear one. I don't think anybody should wait for a transplant. The kidney should be available, and it's up to us to make it available.